National Medical Commission Bill has become an act. President of India has affixed his stamp to Parliament in its wisdom has passed in both the houses. This is in spite of protests by the entire medical profession of the country that what is being done is an injustice to the medical profession and a great catastrophe is waiting for the health of the nation. So, what are the truths? What are the truths? The whole edifice of National Medical Commission stands on the fact not adequate doctors are there in India. Is this a truth? Indian Medical Association will say this is a myth, this is a lie, this is a falsehood that has been imposed on the nation. Every year, 506 medical colleges of our country produce 68,000 doctors. Out of this, 269 medical colleges are in private sector, giving rise to 38,000 medical seats. Rest of them are in government sector, giving rise to 32,000 medical seats. Now, when the MBBS graduates out of the medical college, his first desire is to obtain a postgraduate degree. Since an MBBS degree doesn't fetch him a livelihood, he is not respected in the society, he doesn't fit into either the private sector or the public sector. He is nowhere, he is in a no man's land. 68,000 medical students, 23,500 postgraduate seats. Every year we have around 45,000 medical students who do nothing. They do not become practitioners. They neither can get into a postgraduate seat. So these 45,000 students sit in the coaching classes for the entry into the PG seats once, twice, thrice, or the repeat even 4 times before they settle down somewhere. So every year there is a population of 45,000 MBBS fine graduates of medicine who are jobless, who are frustrated, who are angry, unemployed by a system which is insensitive to their needs. At any point of time, I can very confidently say 1,50,000 MBBS graduates are jobless, unemployed because the system doesn't have a place for them. In every developed nation, we have a health expenditure of around 3 to 6%. For past several years, the GDP that is spent on health has stagnated on 1%. Lancet, in a very beautiful editorial, wrote, Mr. Prime Minister, do you know what is 1% in health expenditure is? It is death in your streets. And we started with a health expenditure of 5% when Jawaharlal Nehru was the Prime Minister of India. Now we are stagnating at 1%. What does this mean? This means the government of India is unable to employ these 1,50,000 fine MBBS graduates into some useful position in national programs. Now, having said that the unemployment in the MBBS medical graduates is there, what is the need to introduce the Section 32 in National Medical Commission Bill, now the Act, providing for community health providers who have something to do. They are remotely connected to modern medicine. Whether they will be trained or not is not even being said. They will be fully licensed. They can be your pharmacist, they can be your compounder, they can be your lab technician, they can be the optometrist who check your glasses. Are they qualified to practice medicine? Have they the background of anatomy, physiology, pathophysiology, pathology and therapeutics which is necessary for a graduate to practice medicine? This is the question we are posing to the people of India. That this is not an issue of the medical profession. This is an issue of the health of the country. For the first time, they are being licensed. We know quacks are there, but quackery is being legitimized. That is the issue here. Licensing these people to practice independently in primary care. What is primary care? Any care up to normal delivery is primary care. So, what all the difficulties that the patients are going to face and how many errors are going to be committed, and to add to this, they can also join secondary care and tertiary care under the supervision of their own fellow man, not even a doctor, under the supervision of a community health provider. They can practice in our critical care, they can practice in our emergencies, they can enter into our operation theatres and our neonatal ICUs. I think is this fair? Is this fair on this government to inflict, if they cannot employ the unemployed 1.5 lakh MBBS doctors in somewhere in these national health programs? Why should they produce doctors of out of quacks? This is the question we are posing to the nation. In this, the medical profession is united. Our war on NMC will continue, the struggle will continue till our people are gotten rid of these community health providers. The protest has to now go to the people, because people are sovereign. People are sovereign in a democracy. The case affects the people. It will affect the health of the people to a very large extent. So, it is now a massive public campaign to tell the people what it is, what it means to their health, what it means to their child. So, this, when the people realize, it will become a people. I am very confident the press and visual media have realized this to a very large extent. That is why a very silent support for what the medical profession is saying is coming up from the press and media. But this will amount to the people being sensitized, and people will rise along with the Indian Medical Association. We have steps which will be in nuances to fight this act. Now in a democracy, we have to engage the government, we have to engage them in the rules making. In rules making, we will at least see harm reduction. How much harm can be reduced from out of this bill? I think this question should be put to him. We are also baffled how he satisfied his conscience. I think he has violated his conscience in bringing this law, maybe due to certain policy changes of the government. But my hunch is he should have resigned. If he is betraying the medical profession, he should have resigned instead of continuing as the Union Health Minister. That is my reaction to it. You have to read between the lines. There is one more point that I would also want to know. When he quotes the WHO that so many doctors ratio is there, what about our alternative system medicine doctors? There are 8 lakh alternative medicine doctors. Has he calculated them? They are equal in parity, status, promotion, everything to the modern medicine doctors. But why they are not taken into consideration when you calculate the ratio of the patient versus doctors? If you calculate the alternative system of medicine equally as a doctor, then the ratio should be somewhere up to 1:500. Is it not? So, I think the whole system of assessing has to change. It's rather a bluff on the people that this has been inflicted. Health is a blind spot for not only this government, but any government which has preceded it also. Somehow, our priorities have been elsewhere. But a time has come that health has to take the due priority it deserves. And quality, patient safety, these are not mere words. They cannot be replaced by public health words like accessibility, availability and affordability. They are secondary. Safety of the patient, quality of care given to a patient. That is why there is a paradox. The government looks at it as numbers. We look at it as patients. For us, every single patient is important. What we give to that patient is important to us. So we can understand what it is going to damage. The government is looking at numbers. Government, by just juggling the numbers of doctors, by including the community health providers as doctors, cannot change the ratio so that the world will respect India. Government should invest more. There has been very revolutionary documents which have been produced by erstwhile Planning Commission, Universal Health Coverage. They are all there. How to the roadmap? At least 2.5% of the GDP has to be immediately apportioned for health. I think this should be a issue of public debate, issue of public elections. Elsewhere in the world, in developed countries, health is an important issue. In the United States, Obamacare was an important issue on which both Republican as well as the Democratic parties fought. So I think health is important. We should start demanding quality health care in public sector, assisted by a public-private mix of doctors, small hospitals, rather than going for for-profit hospitals. For-profit healthcare is a crime. It can never be justified. I think they have to answer this question. They cannot corrupt our traditional medicine. We, modern medicine, has always coexisted with traditional medicine. We had respected them. They had respected us as medical practitioners. And this has been going on fine. It can only be verticals. You cannot mix and produce a hybrid doctor as what China does. Is China our model on healthcare? India is in the frontier of modern medicine. Any care that can be availed in United States or developed countries is available in our country in all the states. Cutting edge technology, fine sophisticated professionals, they are all available in India. There is no reason why, while we are the leaders of medical profession, of modern medicine, why we should forfeit this leadership to something like barefoot doctors of China. This is baffling.